Hi friends, today our topic is the pneumothorax. So what is pneumothorax? For understanding we will split the term pneumo and thorax. So what is pneumo? Pneumo means air and thorax means the chest. So pneumothorax is nothing but the air in the chest or the pleural space. So there are layers in our thorax region, in the chest region. So there are two types of layer. So one is parietal pleura, that is the parietal layer which is attached to the chest outside, and in the other layer is visceral pleura, which is attaches to the lungs. This is chest. So the space between the parietal pleura and the visceral pleura is called as the pleural space. So because of various conditions, there is the accumulation of air in the pleural space or the pleural cavity. So it is called as the pneumothorax. Okay, so this is the parietal layer and this is the visceral layer. So the space between the parietal and visceral layer is the pleural space. So the pressure within the pleural space is maintained by two forces, that is the muscle tension of the diaphragm which expands outwards and elastic recoil of the lungs which pull inwards. So both the pressure are there in the pleural space. So what happens in the pneumothorax? The air in the air leaks out in the pleural space. So pneumothorax happens. So here pneumothorax forms when seal of the pleural space is punctured. So because of the puncture, the air in the air moves in the pleural space. So pressure of the pleural space becomes 0 centimeter of water. So because of the pressure becomes 0 centimeter of water, the lungs will pull inward and the lungs gets collapsed. So because of the collapse of lungs, there is a limited exchange of air. So there is a decrease in the oxygen concentration and increase in the carbon dioxide concentration in the body. So this is the pneumothorax. So there are three types of pneumothorax. First is spontaneous pneumothorax, the second one is traumatic pneumothorax, and third one is the tension pneumothorax. In the spontaneous pneumothorax, the alveoli, which are the air sacs in our lungs, develops the tiny leak. Suppose this is the alveoli and it causes leakage. So air moves out from the alveoli into the lungs in the pleural space. Then the second one is the traumatic pneumothorax. In traumatic pneumothorax, because of the gunshot or any injury in the thorax region, there is the accumulation of air in the pleural cavity. And third one is the tension pneumothorax. The tension pneumothorax can be occur due to the spontaneous and traumatic pneumothorax. So the diagnosis of pneumothorax is through X-ray or CT scan. Okay. So in X-ray, there is the image will be there, which doctor will interpret that the lungs are collapsed. Then the symptoms of this is shortness of breath. Symptoms of pneumothorax is shortness of breath, and chest pain. So if the pneumothorax is in the minor stage, it gets resolved, and if the pneumothorax is at the severe condition, so the insertion of needle in the pleural space is done and the air is taken out. There is a balance in the pleural space. So this is the treatment part of the pneumothorax